You're watching Washington on CBS 10 WILM. Here's your host, Don Ansell.
We're back. Our guest this morning, New Hanover County Commissioner Ted Davis, recovering from a post-holiday triple bypass surgery performed by Dr. Howard F. Marks, Jr., who is also our guest this morning. Before we get into when you woke up, I do want to ask, how long did this operation take with Ted?
About 3.5 hours. 3.5 to 4 hours.
Is that typical?
Yes.
That is. And how many people are in the operating room, generally?
We have about seven
people
in the operating room, anesthesiologist, couple technicians, the perfusionist who runs the heart-lung machine,
Okay.
nurses, etc.
And how big's your scar, by the way?
It goes from about here down to there.
Okay. And I think I asked before we opened the show, did you sew them up? And you said from the inside.
From the inside.
So that it'll be less of a scar as years go by?
It should be, yes.
Yeah. Is that the purpose?
That's routine.
Uh-huh.
They use super glue on the outside.
You have to be still for a while. All right, so you wake up and you wake up and what? Where and what and what are you thinking? Who's around? How do you feel?
As I recall, I think the thing I remember first, it was in the ICU.
Right.
Where they took me after the surgery.
Which is our recovery unit, is our intensive care unit. So you go straight from the operating room
And that's
to
normal
the
for
intensive
that.
care unit. Right.
Right. But you were in there a little, because I was in touch with your wife, Jane, to see how things were going. And my understanding is you were in there a little longer than some other bypass people might be, but we'll get to that in a minute. So did you have pain?
I was on good drugs.
You didn't have it. Well, good. That's what they're for.
I mean, really.
We're not supposed to have pain if we have something to counter it. Is that accurate?
Everybody has, again, that's the bell-shaped curve.
Right.
Someone like me, I'm sort of a chicken. I need a lot of pain medicine. I would complain of pain a lot. Other people, particularly the older men, the World War II group, need very little. So, but
The John Waynes of the
John Waynes.
Right,
But it's important that folks are comfortable so they can cough and deep breathe and do the things they need to do in order to not have complications.
Did he have complications?
Not from the heart surgery, but there were some ancillary things associated.
Unexpected, or are part of the process sometimes?
Part of the process sometimes. We like not to be surprised by anything, having done 3,000 and taken care of many, many more. We see lots of things, so we are always on the lookout. We hate to be surprised. We're prepared, disappointed when things don't go perfectly, but we're prepared to deal with anything.
Were you ever worried after?
The only thing I would say I was worried about was how long, the process of
How long?
recuperating and how long it would take to get back to.
Was it hard to get up and start? Because they try to get you up pretty quick, don't they, to walk
Yes.
around?
Yes, and you're all hooked up to different
All kinds
stuff.
of
But I can't say enough about the care I received at the hospital, in the ICU, as well as when I was taken upstairs. And I know I was gotten up and started walking with one of the nurses there would help me. And as a matter of fact, in the end, when I went to my room upstairs, I actually walked from ICU up there. I mean, I wanted to get better.
How long were you in the hospital?
I would say maybe a week.
About 7 days.
Okay.
And then I was released, but I had to go back in after about 3 days.
Where are you in the process of recovery now? You're back to work?
I've started cardiac rehab,
Okay.
which is 3 days a week,
Okay.
basically an hour.
That's sort of like particular exercises that
Right,
address the heart?
We do stretch exercises, some limited weights, and then basically a treadmill and the bicycle.
Okay.
And they monitor you the whole time about your heart rate and your blood pressure, and everything. I've started going back to work maybe 3 to 4 hours a day.
Okay.
Jane says I have about 4 or 5 good hours a day, and she's right, because after a while,
Are you tired?
you get tired, and I do start to hurt. And I
You
was
do
taking
start to
hurt.
Oh, to
There's a
hurt.
pain for some reason that comes right along in here.
Is that normal?
Everybody is different, but that's certainly within the realm of what we would expect to see.
Okay, okay.
So I was taking a nap, which I've stopped doing. So at night, I'm pretty tired.
Your wife told me, I don't know if I'm supposed to say this or not, but I'm going to say it. Your wife told me that you were a really good patient
Well,
in the hospital and when you got home.
I tell you, I try not to get emotional over it, but my father passed away at the end of September, and his last days were spent at hospice. And to see the dignity that he had as he was dying made such an impression on me. And I know when I was going through this, I mean, you feel lousy, you can get depressed, you know, oh, poor pitiful me, but I tried to take a positive attitude through this whole thing, and I was just so grateful for my wife doing what she did to get me there. I was so grateful for Hank for what he did. I was so grateful for the care that I was receiving. So I just try to encompass that all together and go through it as nicely, being nice to people and as positive
Well,
as
your
I
wife
could.
noticed it
Well,
and mentioned it.
Jane, if it wasn't for her, I wouldn't have gone in the first place, but also I can't say enough about what she did for me after it was over, taking care of me.
Dr. Marks, what are some of the warning signs people should pay attention to concerning the heart?
We can start with TED symptoms. Little tightness in the chest. Many people describe it as an elephant sitting on your chest. That's a little further down the road. You'd like not to get to that point. Shortness of breath. Sometimes people have diaphoresis or sweating associated with that. And then classically, if you're having a heart attack, some nausea and some vomiting. Many people, particularly those who have diabetes, have no symptoms at all.
Wow.
And their first symptoms are of maybe of shortness of breath when they have heart failure from having multiple heart attacks. So again, I know I use the analogy of the bell-shaped curve of the spectrum, but heart disease is a spectrum. And I guess many people, again, describe it as indigestion that are having heart symptoms. So there's a wide range.
Thank you so much for joining us.
Thank you for
and
having
for what
me.
you do.
Thank you.
Mr. Commissioner, we'll see you soon.
And I'd like to thank him too.
And thank you for being here this morning. Next week, a political revolution in Raleigh. State Senator Tom Goolsbee talks about big changes in North Carolina. Next Byline. I'm Don Ansell. Have a great week.
Well, I hope it's...
You've been watching Byline Wilmington on CBS 10 WILM. Join us every Sunday morning as we explore the issues that concern you.